Good afternoon and welcome to Seminole County's press conference this afternoon related to COVID-19. I'm Chairman Jay Zembower on behalf of my colleagues, the Board of County Commissioners, our 7 cities, and all of our partners throughout the region. Thank you for being here today for the news media to help us get out the message. As a lot of you know, there has been a lot of things happening over the last 24 hours with the governor's order coming out, a lot of questions. We fielded quite a few questions in our customers information line. We also want to make sure you make note of that. If you'll just take a moment and make note of the phone number is 407-665-0000. Also online at prepareseminole.org. I know many are still looking for certainty, and I think all of us fall in that same category. What I would urge is patience in the community as more of this begins to unfold. We're not in this alone. We are a countrywide pandemic, and we should treat it as such. I want to assure all of our citizens, not only do we have a great core group of professionals, of which one, Dr. Husty, is unable to be here today because of the mandated 65 and older must stay home. So Dr. Husty listens in. He attends all the task force conferences along with Alan Harris and Donna Walsh, which are here today as well, and our great sheriff, all sitting on these task force to understand what's going on. Each one of these individuals are constantly in contact with their counterparts, not only throughout the region, but at the state and federal level, and understanding what's happening, the newest situations that are unfolding, so we can be prepared here in Seminole County. Also, just a short time ago, I received a call from Mayor Demings in Orange County. Want to assure that regionally we are also working together. This is going to be a situation that is not one county versus another. It cannot unfold to be a state versus state as we're seeing unfold throughout the country right now. I have pledged to Mayor Demings, as well as our other community and regional partners, that Seminole County will be a partner at the table. I've instructed my staff to accommodate those teleconferences that'll be starting next week as we learn and these things unfold, so we do what's best for the region. I know our sheriff is in constant contact with the entire state sheriffs to understand what's going on across the state. We're also talking to the governor's office as well. I would also like to take a moment and thank our school system and our school board who are doing a great job keeping our children educated, as well as making sure their time is occupied for a good portion of the day. As more and more people are staying at home, we have concerns that people are not getting out or not having that social interaction. And of course, we as humans are built for social interaction. So this is a very trying time for many. Our parks and recreation, for the most part, remain open. We would urge you to practice the social distancing. Get out, either in a family unit or you and your spouse. Enjoy the trails, get some fresh air. You can only watch so much Netflix until you run out of the favorites to watch. So with that said, I want to bring you up to speed on the newest order from the governor. We received a letter from the General Counsel of the governor that says our social distancing order will stand. Basically what Seminole County has put in place still remains in place. So with that said, we want to ensure that you're maintaining the 30% occupancy in those businesses that are still considered essential under the governor's order. Maintain your 6 feet distance while you're in these stores, as well as social distancing throughout the community. That includes no more gatherings more than 10 people at a time. This also includes faith-based groups, as well as all businesses that are considered essential under the governor's regulations. We also would ensure that you take the appropriate measures to make sure your family is protected and you have the needs that you do. We have a lot of elderly people that are unfortunately home alone. I received a call just before I arrived with notification. Now we have spam calls coming out to some of the elderly claiming that in order to get the COVID-19 benefits under Medicare and Medicaid, that you must answer a numerous set of questions, and if you refuse to do so, you will not receive those benefits. In such occasion you do receive that call, please call the Citizen Hotline at 407-665-0000 and let them know what's going on and give them as much detail as you possibly can. Again, we also are rolling out a new executive order. Seminole County, we believe, and I believe, we're blessed to have some of the best professionals throughout the region, as well as the state and probably nationwide. With that said, we've been on the cutting edge. March 2nd, this county, Seminole County, pulled the first emergency order of anyone in the state, so we were ahead of the curve. That said, there's still a lot that remains to be done as things unfold. We also were one of the first, and perhaps the only one, to actually have a social distancing emergency order, which actually is the gold standard. CDC has told us, stay 6 feet apart, keep social interaction to a minimum at the 6 foot level, maintain no more than 10 people. We have modeled our complete order under the CDC guidelines, and we believe it serves the best purpose if you truly want to social distance from spreading the virus. So with that said, Alan Harris, our emergency director, is going to come up and tell you a little bit more about our new emergency order. And thank you.
Thank you, Chairman. Alan Harris, Emergency Manager for Seminole County. I wanted to give you an update on our COVID-19 response from the Emergency Operations Center. We currently have 168 positive COVID-19 cases in Seminole County, 162 of those being Seminole County residents, and 6 of those being non-Seminole County residents. We developed a heat map of the most areas where a majority of those individuals are located. When you think of Seminole County, this map should not be a new thing. I mean, if you look at our populated areas, it goes right along with the most populated areas of Seminole County. When we pull out the dots, which unfortunately we can't show because that is a violation of HIPAA and medical confidentiality, but there are red dots all over. But the more concentrated areas are here where the most population is in Seminole County. So it's not really a big surprise to us to see something like this, but we wanted to pull that out so we would have that data so we could really focus on public education in those particular areas. Over the last 3 weeks, we have been doing a lot of work in the EOC trying to assist people that are isolated and quarantined. We've been delivering food. We've delivered hundreds of packages of food. We've delivered pharmaceuticals to individuals, and we've had animal care services available to anyone that may need those services. It is unfortunate that we had to sign an executive order today to require individuals that have tested positive to COVID-19 to stay in their home. And the only reason that we have to do that is we have found that people that are positive with COVID-19 are moving about the county. Not a lot, but our intelligence unit at the EOC calls these individuals every day. And unfortunately, sometimes they don't pick up. And when they return the call, they have said, I've been running errands. I've been out in the field. I went to the grocery store. This is extremely scary, and this is extremely serious, and we will not tolerate it in Seminole County. So this afternoon, we issued an executive order that requires all individuals testing positive with COVID-19 to remain in their homes. We shouldn't have to do this, but we do. Remain in their homes until medically cleared of COVID-19 by a medical doctor or the Florida Department of Health. No physical interaction can occur between these individuals and anyone else that's not residing in the home. So of course they can interact with the people in their home. Many of those individuals are being taken care of by a loved one in their home. But even in that case, we ask that they isolate into a sick room. So a spouse may be in one room, and if at all possible, the other spouse is in the other room, or maybe even sleeping on the couch, because we don't want anyone else in the house to get COVID-19. Violation of this, of course, will be a fine and further charges if the individual continues. We didn't want to issue this order. but it was when we started to hear that people were moving about the county with COVID-19, that scares us greatly. We already have moderate to substantial community transmission, meaning that we know that individuals are getting COVID-19 not from travel, but from moving about the county. We know that through epidemiology, and Donna Walsh, our health officer, will talk about that in just a moment. But we want to stop that. We want to prevent COVID-19 from growing in our community, and we want to prevent it from making an impact to the health system. So currently, our health system is needing personal protective equipment, and we've been able to provide that at some level. Our logistics staging area has been able to provide assisted living facilities over 25,000 gloves, over 11,000 gowns, over 15,000 N95 masks. So that's a lot of equipment that's come through our facility and into hospitals, assisted living facilities, and nursing homes. We're going to continue to do that. We're going to continue to support those organizations, but we don't want to run out of personal protective equipment by individuals moving about the county and the COVID-19 growing in our community, and we don't want to see that. So we've issued this executive order, as well as the other executive orders, to prevent the spread of COVID-19. We hope that people over the weekend and throughout the next couple of weeks will stay at home, will not get in groups of 10 or more. We'll stay 6 feet apart from each other, just like we are in this room. Everyone is about 6 feet apart from each other. We want to make sure that we're doing that also when we're in the community. That includes the grocery stores, the hardware stores, and if at all possible, stay at home. Do not go out and do anything that's not essential, unless it's to walk the dog down the street or a simple walk away from other people. It's absolutely okay to go down a trail or something like that, but we have heard from individuals, hey, the trail's full. Don't go. Pick another time. That's not the time to go down the trail. Maybe pick a little bit later in the day when it's a little cooler, or in the midday, or pick another time. But if you are starting to go down a trail and you see a lot of people on that trail, choose a different time to go down that trail if you want to do that. So with that, I will turn it over to Donna Walsh, our health officer, hero in my eyes. She has been doing an incredible job with the epidemiology and the medical services and the medical support out in the field. So Donna.
Good afternoon. Thank you so much, Alan. And I've said this before, I'll say it again, it's a team effort. We have an incredible team at the health department working around the clock to keep our community safe. And without the county support and other agencies throughout the county, partner agencies, we couldn't make it happen. And it's certainly our community members that can be heroes as well to protect and save lives in our community by adhering to the guidelines and the executive orders that have been set forth. As Alan mentioned, in Seminole County, we have reported now 168 cases, and those reports come out twice a day through our Florida Department of Health on the dashboard that we have referenced several times. I'll give you that information in a few moments as a reminder. With that, we've tested over 1,700 cases in Seminole County now. I believe last week when we spoke, we had tested a little over 500. So the testing has increased. That's great. And we have at least 20 sites here in Seminole County, urgent care facilities. We even have our federally qualified health care centers, True Health, the American Muslim Clinic that's helping those who are underinsured and uninsured. And even we just learned of another urgent care center that is testing now as well. So we have ample testing ability in our communities for those who are insured as well as uninsured. I know that we have said this before about the test site in Orange County at the Convention Center. That is open to anybody. It's not restricted to just Orange County residents. They also have opened it up to more than just 65 and older with symptoms. So please take advantage of that as well. I will say that we have received reports that they fill up pretty quickly. They're really only testing 250 per day at this moment. We have put a request in that they may open that up a little bit too. I don't know if that's possible, but certainly keep that in mind as another location that you can get tested free of charge. With the state, we as a state have reported 9,585 positive cases as of this afternoon, with unfortunately 163 deaths statewide. Here in Seminole County, we have been blessed with 0 deaths to date. And really, we would like to maintain that, folks. And it's so important for you as responsible citizens to do your part to make that happen, to save lives in our community and to keep this infection from spreading. As Alan said, this is a serious infection. It has a higher death rate or mortality rate than the flu. And as we have said many times, those who are most susceptible to complications and death are elderly, as well as those with underlying health conditions, the heart disease, diabetes, obesity, cancer, leukemia, and so forth. That does not mean that everybody is not going to become infected with this. Anybody can become infected with this virus. We are what they consider a naive population. We've never had this strain of coronavirus globally. So anybody is susceptible to contracting the infection. You may be asymptomatic, you may be mildly symptomatic, but you could still have the infection. And 80 to 85% of people so far globally seem to be recovering without complications. However, that does not mean that you can't spread this to somebody who would be susceptible to developing complications. So that's very important. To put this in perspective for you, the social distancing that has been put into place by your county has really helped to reduce the number of cases here in Seminole County that we've seen. So as of last Thursday evening, by the end of the day, we had reported 54 cases. 4 days later, we were just under 100 cases, 99 cases. We had doubled cases in 4 days. If we would have continued on that trend, we would be up to 198 cases today. We're at 168. If we continue that trend of doubling every 4 days, we would be up to 400 cases next Tuesday. It is mainly because of your efforts to social distance and to adhere to those guidelines that we're able to keep the number of cases down, that we're able to prevent this from spreading so much in our community. You all have seen other states where the cases are increasing exponentially, like New York. We don't want to get to that point here in our county, in our state. So we can make a difference. We can do what they call flatten the curve. And if you look at the data, you'll see that our curve is flattening. This is early on, in the identification of the spread of this infection in our community. So we want to continue to see that curve is flattened. We won't be able to eliminate this infection altogether in a week or 2 weeks or 3 weeks. It may take some time. The scientists are still trying to estimate for us through modeling how long it might be, based on the spread of this globally. So we ask for your patience, we ask for your cooperation to help us to survive and to make it through this particular outbreak. So as far as the healthcare systems, as Alan said, we're working very closely with our hospitals and our nursing homes, our long-term care facilities, our first responders. Just as quick as they ask for personal protective equipment to keep them out of harm's way, because they are the most likely to be exposed to persons with this particular virus, the county is providing. The health department's ordering, the county's ordering supplies. We're distributing that as fast as we can. However, if more of our community members become infected, that increases the strain on our healthcare system. And if we increase the strain, we won't have the resources to take care of those folks who are critically ill. So again, it's important on all fronts for us to comply. I just want to leave you with a couple of resources that we have mentioned before. If you have any questions, we do have a couple of call centers. There is the call center located here at the Emergency Operations Center, manned by the county, and that is our Citizens Information Line at 407-665-0000 with any questions. Also at the Health Department, our epidemiologists are standing ready to answer any questions at 407-665-3000. And then the state call center is open 24 hours a day at 1-866-779-6121. Thank you all for all that you're doing to help keep our community safe and healthy.
Well, thank you for being here, and thank you for covering this again. As I sit back and I listen to what's going on, I recognize the greatest responsibility that we have as a civilized society is to protect and preserve human life. And if that means simply staying at home and sometimes doing absolutely nothing, that's the best strategy moving forward. I want to encourage you to stay at home as much as you can. Get that sunshine in your backyard. We want less traffic on the streets, less people going out and about. And if you have to go out there and get those basic necessities, I'm talking about food and those things to keep you going, go out and do that. Now is not a time to go out and shop for household goods or paint or all these different projects you want to do. There's never been a time like this in our history where we're all saying the same thing. I want to thank the partnership that we have with the cities, the police chiefs, all the contiguous counties for that matter, because we're in lockstep with what we feel is in best interest for our community. Since the county has put our county ordinance into effect, we've had about 151 calls to our office indicating violations. And let me just take a moment to talk about that for a second. The spirit in which these laws are created, they're created with the spirit not to increase enforcement, but to make our communities and people safe. So inevitably, somebody's going to pass you in the supermarket. They pass me and I'm the sheriff. The majority of our calls are just like that. I was shopping in this particular location. Somebody was standing in line a little bit close to me. Can you have somebody check up on that? Out of the 151 calls for service, and that number continues to grow, it's probably growing right now as we speak, 28 of those calls we found to be clear-cut violations. The majority of those 28 were for some of the larger stores that were either violating the 6-foot social distancing rule, meaning that they did not clearly indicate on the ground how far away people should stand in line, or the maximum occupancy of the business. There was more people than the 30% that we put in place in there. We will continue to go out and warn and educate. Actually, 2 written citations, written warnings were issued, no official citations as of yet, but 2 warnings were given to a hair salon in Altamont Springs. Last time we had a news conference, I said very, very clearly, if you're doing nails, if you're doing hair salon, if you're doing massage therapy, you need to stop that. It's too great of a risk right now. If you want to operate your business and sell products and goods, do that. But you know, our hair is getting a little bit longer than what we want to. But these are unprecedented times. So that's where we're at. 19 of those 151 calls were calls that resulted in multiple violations. As you can imagine, if you're a large box store and you are not adhering to those social distancing guidelines, there's a greater potential for multiple people to call about the same violation. And that's what we're finding. If we need to write citations, we will. But we want our community to work with us on this thing. Let me talk a little bit about our numbers, and let me preference this because I want to be clear why I'm doing this. I don't talk about our criminal justice numbers as a reflection of what any law enforcement agency is doing, but the numbers of arrests and bookings and all of these things have a direct reflection on what's happening within our communities. That's the only reason why I give you these numbers. The crime rate just between the month of February and March has decreased by 18%. If you compare March of last year to March of this year, there's a 28% reduction. The takeaway from there isn't that law enforcement officers are doing anything special, it's that the criminal element are less active now in our community. That's the takeaway with that. Our calls for service between February and March have reduced by 6%, but 18% when you compare March of last year to March of this year, which means less people are calling in and making complaints than ever before. Traffic stops. If we keep you off the road, that means potentially less traffic violators that are out there. That's what we want to try to continue to do. There's been a 30% reduction in traffic stops between February and March, and then nearly a 60% reduction in traffic stops when you compare March of last year to March of this year. Again, The takeaway there is that people are minding the CDC recommendations, the local recommendations, and there are less people out on the streets. So that's what we're doing. We're also watching some of these social and other types of crime categories slowly creep up or decrease. And let me talk about just two of those. Domestic violence is on a slight rise. You can imagine as people remain in their homes, there's a greater potential and likelihood for domestic actions. I'm asking people to take a deep breath, to love and cherish one another, do whatever you can. But when you have somebody who is normally home together during waking hours at a reduced number, now many people are working from home, it creates a greater opportunity for arguments and disputes. And I know it's incredibly stressful. You've got children that are at home trying to do homeschooling, you're worried about your jobs. There's a lot going on, but we're watching those domestic numbers very closely. Sometimes that would be a great opportunity to take a walk into the backyard or cool off if you can. The other thing that we're looking at is the reduction in the amount of reports of abuse, neglect, or abandonment. And there's been approximately 200 less reports of abuse, neglect, and abandonment going on. The takeaway from there is when you limit the exposure of children who are being physically or sexually abused from those mandatory reporters, there's less people blowing the whistle and saying, you may want to check on John or Jane Doe. That number is alarming. Again, we need to get out there, we need to be proactive, we need to look for signs of physical abuse in the homes, but that's not a number that we like seeing moving in that direction. Bookings in our correctional facility have decreased by nearly 15% in the past 60 days. But when you compare the bookings in March of last year to the bookings to March of this year, it's also a reduction of 40% year-to-year comparison. Let me talk a little bit about a hot topic right now that many people are trying to avoid, but I think it's worthy of communication and discussion. It's church services. We get pastors and everyone is calling us and they're planning to move forward with church services. The majority of pastors have really looked at this and said, in the best interest of their community, their constituents, their parish, whatever type of faith it is, they have discontinued the more traditional church service. Many of them have gone through online services. Some have gone into like a drive-through services, and we've even seen some people that actually are holding services with less than 10 people on the outside. We have always turned to our faith community to allow us to get through some of the most difficult times. Now is no different. So I will ask our pastors, our community faith leaders out there, please pray hard about the message that you give to your congregation. We want to minimize this challenge as much as possible. We understand that it is our faith that will get us through this. We understand the importance of our religious ceremonies, but let's not unintentionally create a spread of the virus because you may be asymptomatic. You may feel that your faith is strong enough to say, I feel like this is the right thing to do. But it's all of those people who we may come in contact with after that gathering that brings us the greatest concern. So let's just please, as you're thinking about what to do, pray long and pray hard on that, and let's minimize the spread by following the CDC best practices and the ones that we've messaged here. Last and certainly not least, our law enforcement officers are still proactive. Just 2 days ago, members of the Seminole County Sheriff's Office stopped a stolen vehicle going through the county and arrested multiple suspects for armed trafficking of heroin, possession of cocaine, possession of firearms by a convicted felon. There was a series of probation and parole violations. In that vehicle alone, 5 kilos of cocaine was confiscated, 80 grams of heroin, 2 handguns, and a rifle. That resulted in a search warrant of a home. which brought in large amounts of cash, about $200,000 street value of drugs, additional firearms and ammunition, and we actually partnered with the Florida Wildlife Commission because there was a pet alligator being stored in the home. The message out there is anybody that feels like this is an opportunity for them to go out there and commit crime is mistaken. We will hold you to the fullest extent of the law. We will make sure that you're held accountable, and let's pull our community together to do the right thing. Thank you.
Thank you, Sheriff. And as you can see, we truly are blessed here in Seminole County to have such a great group of leaders collaborating and really looking out for the best interest of Seminole County. This is the time that people should be paying attention. If you see something, say something. You can do that at 407-665-0000. You can also get almost any information you need related to this pandemic at that. If you have just general information, if you are an elderly person that is struggling to get supplies or have a need, we're working with many of the charitable organizations. You can also go to prepareseminole.org. There are also links where you can make donations to some of these charities, which are truly helping us here in the community. And so as we move forward, we would ask for everybody's patience. We will get through this, and we will get through it with everybody's help and assistance. And I can't thank the citizens of Seminole County enough on how gracious you've been for the most part in doing what's right for your fellow citizens. So with that, I'll open it up for questions.
Question for Alan. Yeah. So Alan, when these people that are going out running errands, you're checking on them every day. Where's the disconnect that they don't know they're not supposed to stay in their house versus do they not have people helping them get these items they need, or what is the disconnect, I guess?
So we are willing, and we have provided hundreds of containers of food to individuals. We have provided pharmaceuticals. It's not a large number, but one is alarming to me. That means one individual has gone out somewhere in our community, could be into a shopping plaza, could be into a grocery store, that our families are going to go in there and they're going to shop. The employees that are in there now have been placed in harm. They have all been told that they need to stay at home. And that doesn't include just the positive individuals. That includes the people that are under investigation, the people that have taken a test and haven't gotten the result back. They are told that they need to isolate and quarantine in their homes. And they're called every 14 days. Why they chose to do it, I cannot answer that question. I can't even imagine. It doesn't compute in my head. If I had COVID-19, I wouldn't go. If someone said you need to stay at home, I don't know why someone would decide that they thought this was a good idea. But we're not going to tolerate it here in this county, and that's what this executive order is about.
What kind of fine are they facing?
$500 is the first, and that's the extent of what we can do in the county code. If we need to do additional, I can ask the sheriff where we would go for additional. We don't want to lock someone up. We want someone to follow the law, and this is just a means to follow the law. So hopefully people will understand now that there is a penalty that will be levied, and if they don't do this.
Were you stunned or furious?
Both. And I will tell you, so I got the report yesterday that 5 of our individuals had done this. And I tell you, I went home to my family and I said, we're not leaving the house. We're not going anywhere. If we go to the grocery store, we're going to go to the grocery store. We're going to come home, we're going to wash our hands for 20 seconds, and we are not leaving this house again. Because if it's happening in this county, it's happening in other counties too. So that is our pack until this calms down. We're not doing that. And hopefully in Seminole County at least, this will be enough to entice the individuals to stay in their house.
Do you have any other counties in Central Florida taking similar measures
I have not heard of any other county. I don't know to what level individuals are being called in other counties. I can tell you in our EOC, our Emergency Operations Center, we are calling individuals every day to check on them. And I will say 98% are very appreciative. 98% are very communicative with us. We ask for their needs. I mean, it's quite a service that we're providing in this county, and not necessarily is happening in other places. So you don't have to leave your home. We provide, if you're unable to, we provide food for you. Obviously, if a family member can go get food for you, then it's always best, and they can drop it off, and we tell them how to safely drop it off in front of the house. Don't go inside, blah, blah, blah. But if you can't, if you're single, if you are on a fixed income or something like that, we're providing it for you through our nonprofits that we had here on Wednesday. So there should be no reason for someone to go out of their house except blatant disregard for their community.
But the question is, how do you enforce it besides putting a GPS tracker on these people? Or do you have a deputy drive by these people's houses to make sure they're there? How are you going to prevent these people from leaving their houses, even though you tell them and you put this order in?
Well, I certainly hope that the state of Florida doesn't get to that level, and I know another state has gone to the ankle bracelets and stuff like that. I hope that never has to happen here. I'm hoping that through this executive order that people will do that. There's ways, of course, that we can find out, and that is, of course, we call them and there's no answer, and they call back, we ask them where they've been. Their neighbors sometimes know what's going on, and one of the ways we found out was their neighbor said they left the house. They knew they were positive next door. They had seen us drop off supplies, and then they saw them hop in their car and drive away. So they knew that they had driven down the road. Now, this isn't happening only in Seminole County, which is why when I went home, I live in Orange County, I work in Seminole County. That's why when I went home, I said, we are not leaving the house.
So are you encouraging the neighbors to do that? Like if you know your neighbor?
Absolutely, yes. If you know your neighbor is tested positive for COVID-19, and you see them hop in their car and drive down the road, we absolutely want you to call us.
And it should be not just the person that has the COVID, it should be anybody in that household?
So the person, well, it depends. Most individuals that would be in the home, I'm looking to Donna Walsh, most of the people that would be in the home would be either under a patient under investigation or positive for COVID-19. So we would hope that none of them, well, we definitely say that none of them should leave the house. But the order is specifically for those that have tested positive, because we know for a fact they have COVID-19. We know for a fact that because of testing, we know they have had the symptomology because they've gotten a test. But you can't just go get a test unless you have the symptomology, not even in the drive-through testing site.
But you know that 5.
At least
tested
5.
Positive.
Yes,
Left the house.
that's correct.
And that's what this order is about, to make sure that there isn't 6.
That's correct.
Just want to ask you about the map real quick.
Sure.
I've seen people talk about this. Obviously, those are concentrated areas because those are the most populated. So does the map really say anything other than the fact that these are the most populated areas, and that's where the COVID-19 is?
I'm really actually very happy that you asked that question, because while it does show our most populated areas and where most of the COVID-19 obviously is, because that's our most populated area, I cannot show the map because of medical security where individual points would be, but I can tell you this entire map has little dots all over it.
But I don't know if this is a question for Donna or not, but this map is great and the cases are great, but we just talked about how the Orange County Convention Center testing closed shortly after it opened. So when there's limits on testing like this, how can we accurately know how many people actually have COVID-19 in this county or anywhere?
Sure. So the convention center is just one site that's available to us here in Central Florida. In Seminole County alone, we have at least 20 different sites that folks can go to get tested. So the testing is widely available at this
Are there
moment.
limits on those testing centers?
No.
Okay.
No. Your private doctor's offices are referring to urgent care centers or the hospital if somebody's critically ill, if they require hospital care. We're telling folks, though, if you don't require hospital care, please don't go to the emergency departments. Preserve those emergency departments for people who are critically ill. We've also provided for those who without insurance, underinsured and uninsured, through partnership with True Health and the American Muslim Clinic in Longwood. So, you know, we're also reaching out to our community partners to assess whether or not we're missing needs with the homeless population. So the health department makes routine visits to our homeless population areas, and so we're making sure that people in those camps and so forth who may need assistance as well. So the tests are available. The state of Florida just learned that the Abbott quick test, it takes about 5 minutes, that 50,000 test kits are getting ready to be deployed across the nation. And so, or here in Florida in particular. So that will make testing even more readily available and quicker results. You know, some of our commercial labs, because of the volume of tests that are coming in, they're oftentimes taking upwards of 4 to 10 days for results to come back. Our state laboratory is turning around test results in 48 hours. This quick test, this will provide us information very quickly, and we'll be able to talk to folks and keep it from spreading even faster.
Yes.
Regarding the letter you said you received from the governor's office, can you clarify when you received that? Because there was some confusion with the executive order regarding church gatherings and social distancing. So when
Sure.
did you find out that
Alan may be able to more appropriately answer that because it comes into our emergency management through our legal team. Late last night, early this morning.
This afternoon, I can get you, that's fine.
Yeah, we'll get that. Happy to share that information with you. Absolutely.
It was today.
Right. Absolutely. Yeah, I mean, it was clear, you know, our legal staff believed that ours would stand, but we wanted that clarification from the governor's office, and we've now received that. It's my understanding that all the counties have now received that. And so each county will have to make their own decisions, you know, moving forward and what you know, ultimately they want to do. But again, we feel if the goal is truly to mitigate the spread of this virus, in our opinion, what we've put in place is truly mirroring the CDC guidelines and is the standard to not pass this virus any further than we need to. Any other questions? Well, seeing none. Oh, yes.
I'd like to share, you said I think that most churches were complying. Are there any that you have found that have not been complying? And what could they be facing if they don't comply, you know, with these orders?
Well, they got to make the decision that you know, when the churches make a decision to have service, I mean, they've got to do that, what they feel is in the best interest. There's no question faith is a big part of what's going to pull us through this. And I think that is incredibly important. But I think that sometimes what's lost in the mix with the messaging of this is we cannot devote a significant amount of our time addressing that small percentage of the people who may be planning to violate. If we get complaints, we're going to go out there and we're going to warn our pastors, and we're going to work with our pastors. These are good men and women that clearly are making decisions that they feel is in the best interest of their church community. Nobody out there, none of these pastors or religious leaders would intentionally do something that brings harm to others. So I think that when we provide the science and the data and we communicate with them, we've had great results with that. So again, it's not my intention to get in any type of battle with any religious leader. They are who we need right now to kind of pull us through. If we do get a call, we're going to go out there and we're going to talk with them. But I am confident that they're going to make the decisions that are best for them and our community.
So no calls yet, though, or complaints? As far
No calls yet. But you know, we anticipate over the weekend is where a majority of the places of worship have their services, and you know, it may come this weekend. But again, I ask those leaders to pray on it and make those right decisions. We'll get through this. We'll get through it much quicker if everyone abides by the rules. Stay at home, you know, protect your family. Let's get through this thing, and then we can go back to life as normal as it can possibly be after this.
Sheriff, is there extra concern about Easter and Passover coming up?
No, I mean, I think that, you know, Easter is a big day for me and for the majority of our communities. And I think that the additional prayer and the faith is a wonderful, wonderful thing. But again, you know, I'm not going to spend our resources, our time focused on such a small percentage of the people who may not want to comply or may not do anything. What it does is unnecessarily devotes all of our resources that goes towards supporting and protecting all of those people who are complying. I mean, the reason why we're imposing these laws in the first place is to protect them. The last thing I want to do is to do anything to hurt them. I'm asking and pleading for their support in this. And I'm confident that they'll do the right thing.
Sorry, one more thing for Alan. You said you learned these people had been going on errands, going to grocery stores. Did you find out which specific grocery stores and then alerted those stores that someone had recently been there with COVID-19?
No, they wouldn't tell us. So that's another reason why they weren't very forthcoming where they had been. So that's another reason why we issued the executive order.
Well, as we wrap things up, I would urge, please be patient. We all will get through this together. You know, what I would ask that you do is keep in your prayers our first responders, our healthcare workers. These are the heroes. These are the unsung heroes that are living this every day. Their families are living it every day because their loved one is away from home, looking after the people in the community, as well as our emergency management people who are doing just round-the-clock work. Fortunately, we have a lot of staff at the county that are devoted to this. And again, if you see something, please say something. Just give us a call at 407-665-0000. Thank you, and God bless.